Good evening. The time is now 5:10. Today is Thursday, November 20th, and we are going to go on to a special call meeting for the Alice Independent School District. For this meeting to be held in our boardroom, located at number 2, County Trail, Alice, Texas 78332. This meeting was posted to begin at 5:00 p.m. I'd like to welcome everyone here in the boardroom and everyone who's watching online to our meeting. Item number 1 on the agenda, this meeting has now been called to order. Item number 2, the roll call and to establish a quorum. I myself am present. Excuse me, my pen isn't working. Jennifer Barrera, we have Dr. Anicia Trevino. Absent is Vice President Mr. Herman Ariano. Absent is Secretary Mr. Cira Zamora. Present is Trustee Mr. Adrian Peña. Present is Trustee Mrs. Deborah Guerra. Present is Trustee Mr. Cody Reeves, and present is Trustee Mr. Lee Ramon. At this time, we have a quorum. On to item number 3, the Pledge of Allegiance to the United States flag and the United States.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. On the Texas flag, I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
On to item number 4, the public comment. At this time, Ms. Hunter is passing us the public sign-in sheet. There's no one who has signed up to speak at the public comment. On to item number 5, the presentations. Dr. Trevino.
Yes. Good evening, members of the board, members of the audience. Today we have 2 important topics to discuss with the board as far as future facilities and future health insurance possibilities for our staff. So the first item is a health insurance presentation and discussion. This will be a presentation for the board to start evaluating possible services or changing the services for the upcoming school year, and that would be for the 26-27 school year. If we all know that insurance prices have gone up for the last multiple years, and last year the board was very courteous enough and frugal with their money enough that we were able to provide $75 more a month per employee. So our contributions per employee is $375 a month. Nonetheless, the premiums continue to go up. And we're trying to look at different options that districts may have to cut those for the staff and yet continue to provide quality services for our employees, or maybe even better than what we've been getting. And we have looked at the buy boards and co-ops throughout the state to see what can be an option that we may have. Currently, we have been with TRS, and we've been with TRS for a while, but those costs continue to rise. So what can we do as an entity to continue to provide services for our employees, but at a smaller cost to them, so they can see more of the raises as opposed to it going all to insurance? And so we have invited Shayna Robinson, who is part of those co-ops, to share what her company offers that maybe we could entertain. Because if we will be making a change to our insurance carrier, those changes would need to be done or announced anyway by December 31st. And because of that, we're on a timeline, and then we would bring something up for the board next month if that is a recommendation. So, Ms. Robinson.
Thank you. Good evening, Madam President, Dr. Trevino, and distinguished board. Thank you very much for the invitation to come and hopefully shed some light on a very difficult subject, right? So we all know we need insurance, and I believe it needs to be affordable for everybody, but it also has to have robust benefits in it that we can access, or we really don't have insurance at all. So with that, I'm going to jump right in. There's a lot that I want to cover this evening. If there's something that you want to know a little more detail about, please stop me. The most important thing that I want you to hear is there are opportunities out there. You are no longer in Hotel California. You can leave TRS. So about 4 years ago, they actually said you could do that. And the caveat they added this year is you don't have to wait 5 years. Let's say that we took you out this year and you all decided, wow, we want to go back for some reason or another. You now have the ability to do that the following year. So it really gives a lot of confidence to being able to get out and try something new. I have left a packet in front of all of you all, and then we'll obviously be up on the board as well. So predictability the right way. What we are able to offer and what we're offering to our clients right now is locked in at least 2-year guarantees. That gives you that 2-year confidence that you can go ahead and come out. Everybody worries about their premiums inflating the following year and then not being able to be affordable. No deductibles, no copay for primary care, customizable networks, as well as cost savings based on the leverage that we're going to be able to utilize by removing one of the big systems out of the plan. So the more that we can narrow it, but keep it robust to who all you all want to see, then we're able to reduce those overall premiums at the same time being able to provide robust coverage. Oh, I'm sorry. I should probably move my slides. So something that was very important to Dr. Trevino was making sure that we were not going to go self-funded. So the first thing I told her was, I can absolutely promise you, I'm not even going to make that an option. But I want everybody to understand what we probably are going to look at if this is something you all want to pursue. For sure, fully funded, but also level funded. And there's a little bit of differences, so I want to go over that. In the next slide, it gives you all 3 of the options that we have as insurance brokers. Self-funded, where we know what that is, right? You're going to pay every single claim individually that comes in. You have a bank account that stays open, and they just draw your money out every Monday. For really big groups, that's a good thing. It's not so good, I say, for groups under 2,000. So then the next option that we have is level funded. This is where we're seeing a lot of opportunity and a lot of customization, where we can create something for AISD that fits for your employees and your family members. The other nice thing about level funded, it is going to be one cost per month. You're going to know exactly what that bill is. It never goes up, it never changes. So it stays consistent and it's predictable for your budgeting purposes. The other nice thing about level funded is if we were to hit a threshold below 70% of what your total premium is, we actually get 50% of that money back. We can't do that with fully funded. Fully funded is still a great option. They just seem to come in a little bit higher for the premiums for some reason or another. But just know that we have 2 of those at our disposal, and that would be the RFP that we would be submitting in January if you all chose that you wanted to venture out and do something that we believe would be in the best interest of your employees. You can see across the board right now the rates that we're able to offer in your area, to include Greenville ISD, which is North Texas, right now are at an average of 25% less than what you're going to pay for TRS next year. So unfortunately, we know that with TRS, you're going to go up anywhere from 10 to 13% consistently across the board. I just listened to one of their presentations about 3 weeks ago, and they made the comment that next year they're looking at anywhere from a 10 to 15% increase. Their comment was, that they've got a large pool that they've got to cover. They've got expensive employees across the state, so they've got to be able to balance that out. That being said, we know that they're never going to get any cheaper. So this is a great opportunity to find something that is more affordable, make sure that everybody has access as well as has better benefits. We integrate Attentive into our medical proposals, and the reason is because it gives you free 24/7 telemedicine for everyone in your family. If you're raising a grandchild, if you're raising nieces and nephews, if you don't have your children on the plan, if you don't have the plan at all, you have telemedicine 24/7 free. It never costs you a dime. You're speaking to a physician because we want to make sure everybody has access to care. The other thing that we want to try to avoid is people using the emergency room for a primary care visit. I tell people all the time, you should never go to the emergency room unless you have a cut off limb, a stroke, or a heart attack. Sounds a little aggressive, but we see more sinusitis and broken toes in the emergency room than we ever do true emergencies. We all know, and I was a hospital executive for 14 years, walking through that threshold is an $1,800 expense for your plan. So the better managers we can be of our plans and understanding that and trying to be good stewards for everybody, then the more manageable and the way we can maintain our premiums. So we add attentive into our plan so that we have access to that telemedicine as well as mental health. Once again, 24/7, no copay, everybody in your family, it doesn't matter if they're on the plan or not. We know that one of the hardest appointments to get right now is mental health, and it's one of the most critical. So what we're hearing across the board, if you have United, Blue Cross Blue Shield, Aetna, it can take you 6 months to get into a provider. Some people don't have 6 months. So we want to make sure that you have access through telemedicine. You can actually Zoom with a provider, you or any one of your family members at no cost whatsoever. So basically, you're also going to get extra money in your paycheck because we're going to reduce your taxes and give you more net pay. You've got the telemedicine and mental health. It benefits your district because you're going to save on matching those taxes. You're also going to lower your claims. The beauty of attentive is none of those claims we're talking about. If you end up, true story, my husband ended up getting poison ivy as we're leaving to go skiing. By the third day, he was a red polka dot, and then they were starting to turn into boils, and we won't go in any further than that. It was miserable. So we were calling telemedicine on a daily basis, trying to figure out what were we going to do to take care of him. Every one of those calls hit our claims. So although we didn't have a copay, the $75 cost that telemedicine had already scheduled with TRS, and there's obviously it wasn't TRS, it was United, was still hitting the back of our claims. Having attentive means none of those calls ever from telemedicine or those mental health ever hit our claims. Once again, saving money so we maintain those premiums. So what we've tried to do at Robinson Brokerage Firm is think outside the box and be very innovative. So once again, we can be good stewards to your premium. And then why choose attentive? Why is it something that we believe that we should add in? It's great for recruitment and retention. The other thing about attentive is it comes with a comprehensive care plan management. It comes with a full EAP program. So if you're currently paying for that, you can start saving that money and put that towards something else. And something else that we see high utilization is called a Neura. You hold your cell phone up to your face. It takes 30 seconds to scan, gives your blood sugar, your blood pressure, and 8 other screenings within 30 seconds. Our diabetics love it because they don't have to prick their fingers anymore. It is a paycheck reduction, and I'm not going to go into all of that. If you all decide that you want to move forward, then we would go extensively through that, as well as we would explain that to all of the employees as well in their information session. Plan suggestions for cost savings. So some of the things that I've learned over the years, 14 years hospital executive, 10 years prior to that I was a pharmaceutical rep, and now I've been in the insurance business for 10 and owned my own company. So things that we know are really important. We want to do an on-site enrollment. We want to sit with every single employee, and I want them to tell me all of their medical history and their family's medical history. Because the more that we can find out, then the better plan we can suit you for and make sure that you're in the right plan for your overall expenditure throughout the year. We're also going to be able to gain that information so that we can help you through our nurse extension throughout the year. Biometric screenings and health risk assessments. If we can prick your finger and find out what your cholesterol is and your blood pressure is and your triglycerides, then we can help manage exactly what you look like on the inside and HRA is on the outside. With that information right there, we have found, I can tell you, one of my companies is a dispensing facility. They make Coca-Cola machines. And we had 13 people that had blood sugar over 700 and didn't know it. For those of you that don't have diabetics in your family, because I happen to have 2 children that are diabetics, your blood sugar should be 100. So it's amazing what we find out when we prick your finger, particularly for those that don't go to the doctor. So just doing those 2 screenings can be very advantageous, and then we can get you the help that you need so that you don't end up in the emergency room with an ICU visit. I tell everybody an ICU bed is the most expensive you'll ever lay in. It's $12,500 a night. So we want to keep you out of there. Some other suggested things are nurse consults, annual physical. We are big proponents of that and think that everybody should do that. And then we also want to utilize those screenings. We want to make sure that people are getting their mammogram, their pap smears, their PSAs, their colonoscopies, and we like to reward people for doing that. Remember, I'm able to see everybody's claims every Tuesday, so we stay on top of that and we intervene when somebody needs help, as well as if we see that they're getting their screenings, then we like to reward them. Recommended, these are some of the questions that we've received in the past when we've had these same conversations about taking people out of TRS that have been in it for many years. What if my current physician isn't a network? then we're going to go solicit them and ask them if they want to be a network. I will tell you, all of the TPAs that I currently work with are paying more than Blue Cross Blue Shield, Aetna, and United. It does not mean that we won't have a large carrier as a rep, and I'll explain that in just a minute. But when you go with one of those entities like a Blue Cross Blue Shield through TRS right now, unfortunately, they don't have the flexibility of adding and dropping doctors, and we do. We have not had one doctor in Greenville that we didn't add, and we had 125 on the list. We were able to add all 125 except for one. It was an OBGYN, and she chose to drop Hunt Regional, which was the hospital system that's there in Greenville, and so chose not to be in our plan. So it had nothing to do with the plan. What if my specialist is not in network? Once again, we're going to ask them to join the network. If not, we're going to help them find a comparable provider. What if an employee is in the middle of care treatment and needs to stay in that facility? We get a continuation of care. We are not going to tell somebody that's in the middle of a cancer treatment, a heart treatment, or about to deliver a baby that they cannot go to the institution that they want to. That would always be a continuation of care, and they would finish their complete whatever their care was that was needed for that condition at that facility with that physician. If they needed to go to MD Anderson, that's called a waiver, and we would make sure that they had that. We would just call MD Anderson and get a cash price in advance so that we could build that into our plan. And then the last thing that people like to ask is what medication is not on the list. That happens on occasion. That happens to you guys at TRS whenever they change your PBM provider. So Novolog and Humalog are two real life examples, right? Those are both insulin. They both do the exact same thing. They just happen to be made by two different companies. It might be that you're on Humalog today and the brand provided in our new insurance might be Humalog. So you would just have your provider rewrite that prescription, or the pharmacist would switch it at the counter. Ensuring quality healthcare. What are some of the things that we've done to make employees' lives easier, make sure they have access to care, and make sure that we can keep our premiums manageable? So we are currently using several international companies. Global RX is one of them. What they're able to do is get drugs 50 to 60% less expensive than what our big providers are getting them for. What they're basically doing is going and purchasing drugs from Norway. They're using Mexico, they're using Canada, and about 5 other countries that of the medications that were made in the United States, shipped over there that now they have an excess of. We're buying them back at 50% of the cost, and then guess what? We're shipping them directly to your employees' homes, and they have 0 copay. So their compliance, and it goes way up, so we know that they're taking their medication, they're able to afford it, they don't have a copay, and we're only spending half the cost. So the plan is saving a lot of money. Another thing that we've done with some employees that have very high cost, some of those we're shifting over to the ACA. So businesses have been doing this for 13 years. So for those that ACA plan would be better suited for their family members, if we're able to switch them over to the ACA, and that is a better plan for whatever condition it is that they have, then we switch them over. They come off of the district's plan. Once again, it ends up being an advantage for both entities. And then last but not least, we really want to look for different entities that have 0 copays, open access. We don't want HMOs anymore. I'm not going to bring you any of our plans that have an HMO where you have to go to a doctor first to see a specialist, as well as 0 deductible. Right now, those employees that have TRS on the primary care plan, which is going to be about 80% of your employees, I can assure you it is across the board. They have a $2,500 deductible, for those of you that don't know, before they get any medications, unless it's generics. So they have to spend $2,500 before they can pick up a prescription at the prescription cost. So we want to remove all of those deductibles. On the primary plus side, it's a $200 deductible. Yes, this has been done. We are creating networks all over the place. These are just a few of the different districts that are currently using their own district plan and get to build and design it around their employees. So what are the rates? What are some of the things that we feel confident that we know that we can offer? Right now, Kingsville ISD, as of January the 1st, will start on one of our plans. They're using ESD 100. Their wrap is United. And it's important that everybody hear me say that, because as we talk about TPAs running our plan instead of a big BUCA, which is a Blue Cross, United, and Aetna, they will always be wrapped with a major carrier. And the reason is we have college kids that don't live in the area. You might have stepchildren that don't live in the area. You might travel frequently. You might have a spouse that lives 6 months somewhere else due to a job. So we want to make sure that regardless of where you're at in the United States, you have full access to all healthcare that you need. So you're always going to be wrapped with a major network. Currently, we're using Cigna, United, and Aetna as our wraps for different entities that we have. But most importantly, right now, the AISD 100 standard plan that they're going to use in Kingsville, that would be very comparable to your primary care plan. The employee rate is $431. And so the AISD high plan is going to be $494, and their high deductible plan is $435. And in just a second, I'm going to show you what the comparisons would be to what you all have right now. There is no primary care required. It is not an HMO. It is a PPO, open network. They have a $25 deductible, primary care instead of a $30, $50 specialty instead of a $70. Urgent care is $50, and once again, they do not have that drug deductible, and then they've got the free telemedicine. Unfortunately, with HDHPs, we know that you have to hit that minimum for the federal government, so you've got to hit that $3,300 threshold before you get any benefits, except the telemedicine is still going to be free even for that those that choose the HDHP plan. Greenville ISD, another one of our clients, and they've already gone live. So I don't know if you all are aware or not, in the Baylor Scott and White area, which is kind of that Dallas Metroplex, they pay the highest premiums, and their cost for healthcare is much more expensive than everybody else's. So we were able to lower their premiums almost by $100 across the board. So they went from $556 this year to $464. They have a zero deductible. If they use Hunt Regional, which is in Greenville, if they use Baylor Scott and White, the most preferred in all of Dallas and Fort Worth, if they use the Methodist Hospital, or if they use SPAWN, which is your equivalent to Christus, they have a zero deductible. You don't pay for an MRI, you don't pay for lab work, you don't have to pay a deductible to go in and deliver a baby. So what it's doing is getting people the care that they need because they've avoided it because they couldn't meet or afford the deductible. No deductible on the drugs, no deductible on their health care. They also have primary care visits at $25, specialty at $50, and then their drug costs are $10 for generic, $60 for brand, and then 30% after that. And then once again, the AISD buy-up plan is very similar. It's just the deductible is a little bit lower. I don't encourage anybody to go in that plan because I don't know why you'd pay more for a zero deductible when you have a zero deductible in the cheaper plan. So we've switched the majority of people over. So those that were on the primary plus are now saving themselves about another $300 a month. You can see there kind of what the comparison is compared to what Greenville's costs are this year as well. Another new carrier that we have recently been introduced to, and it's really exciting, it's called Curative. And so they operate a little bit differently. So it is a gentleman out of Europe, born in France, that became a billionaire through some of the very creative IT things that he invested in and designed. And so he is single-handedly funding Curative. He believes in healthcare for everybody, and he seems to have a really good handle on how to manage it. So with Curative, it's zero deductible. No matter what you do, if you go in to have a baby, you pay zero. You don't even owe the 30% copay. Zero deductible on your meds. You can either mail order them from his pharmacy that's in Austin, or you can use your local grocery store. So they've done all the cost comparisons, and they know that the most cost affordable are going to be your HEBs, your Walmarts, the other grocery store chains, Costco, Sam's, but you're not going to have access to the CVS and the Walgreens. Zero deductible for your meds. So they're really putting their money where their mouth is. The other thing that they're doing that's very creative and different is if you want to go outside of network, let me give you a real life example. They are not in network with Baptist in San Antonio. They're in network with Christus. They're in network with University. They're in network with Methodist. They are not in network with Baptist. But if you have delivered 3 babies at Baptist and you are adamant about using your OB, they have a credit card that every single employee gets. They call ahead, they negotiate a rate with Baptist, you hand them that credit card, and the full entire amount goes on that credit card. You still get to go where you wanted, you get to go out of network, and you don't pay a deductible. So they believe if they negotiate that rate ahead of time, they keep an employee happy, as well as that entity they decide what they're going to pay that entity instead of that entity deciding what they're going to pay them. So that's how they're managing cost across the United States. So they have White House ISD is the example that I used right here. Currently, they have the City of Farr, City of La Jolla, City of Sherryland, and there's about 5 others in the Valley. They have Bert Ogden is one of their current clients. They took over most of Region 12, those groups that were in that big giant co-op that blew up. And so they are gaining business across the state of Texas. They've got over 100,000 lives, and they started 3 years ago. So that is another option that we have that I am very excited about. And the rates that they are looking at would be about $400 for that primary care plan that would be equivalent to TRS. You can see here kind of on the next page what that plan would look like, as well as everybody gets that credit card. The other thing that they're doing with that credit card is if you go into your doctor's office and they're out of network, and it's an orthopod that you really need to see because they specialize in hips and nobody else does in the area. Once again, you're going to walk in, you're going to ask that doctor for their cash pay price, and believe it or not, it's always cheaper than what we're going to pay with a negotiated rate. You're going to hand them that credit card, you're going to ask them to charge you the cash pay price, you're going to use that credit card, and the credit card is billed back to the owner of the company. The employee doesn't pay a dime. So they are really trying to get aggressive and utilize access to healthcare so that we do the right thing and we don't delay the care that we need, and they give you the money and the access to be able to do that. Right here is what you're currently paying. Then we've added that 10% that TRS has promised us that they're going to go up. Whoop, I must have gotten excited on my my clicker. And then compared to that, we just went ahead and threw the Kingsville rates on there so you can kind of see where you guys will be next year. So we would be able, at a minimum, to save the employees about $130 on that basic plan, which is where about 80% of your employees are going to be. Remember, 0 deductible and no deductible on your medications. And it's going to be an open network, as well as on the high plan that they have, which will be equivalent to the primary plus. They're at $495, so you'd be saving your employees about $170
A month.
And then,
A month, right?
yes, ma'am, a month, thank you. And then on the HDHP, they'll be about $140. So across the board, employee and children is always very important to me. We have a lot of single parents that are trying to take care of their children. These prices are down $300 to $400 compared to what TRS is going to be next year. So the choice is really to change or not to change, right? So if we are able to give you something that's 25% less expensive, open access, you're going to have a PPO network. We're going to be able to remove the HMO model and drop your cost by 10 to 13% overall across the board. Then we believe that the annual premium increases are not worth it. The expensive deductibles are not fair to employees. And then the rigid networks that are hard to get in and hard to find a provider. So the security for the first time of being able to come out of TRS is now really given back to the hands of the board, because you can come out, yet you can still go back should you choose to later. So the real question is, are you ready to do it? Definitely something to think about. And obviously, we've got about a month for questions and any other kind of investigating, referrals, if you want to call other school districts. So we can provide you whatever that is that you're interested in. But I can tell you that leaving TRS has been a very, very beneficial opportunity for everybody that we've worked with. We've taken out about 10 school districts down across the state. Lasada is one of our clients in the Valley, and we go all the way up to Greenville, and we're working with Crowley ISD right now as well. And then we've got districts all in between. But we believe in access for everybody, and we believe that it should be affordable.
Do y'all have any questions?
With y'all's yearly on the physicals, do y'all offer like a wellness plan discounts? Like if they are non-tobacco users, they get like $50 off a month or?
Yes, sir. So what we typically do, if you do the biometric screening in the HRA, then you're going to see a 25% reduction on your premium. If you have a spouse, then you both have to have it, right? It can't just be one or the other. But yes, sir, we have all kinds of incentives because we truly believe if we can get you to do that, then we're going to be able to get you the help that you may not even know that you need. New Braunfels Electricity is one of our clients. So we do the wellness for them. And you're talking about average age is about 26 years old. It's the guys that are climbing the poles, right? Honest to God, I'm not making fun of them because I'm a Big Red user or used to being, I try not to drink Big Red anymore. They walk in and grab a Big Red and a bag of chips, and that's usually their lunch because that's the only thing they have time for. When we did their biometric screenings in their HRA, 26 men had blood pressure over 300. We were driving people to the hospital in New Braunfels. I'm not exaggerating. So it's the unknown that ends up being that ICU visit, or, you know, pray to God that it doesn't end up being something worse. But if we can prick your finger and get a little bit of information, and then you can help out with an HRA and tell us exactly what your lifestyle is, it can be an absolute game changer, and we can get you to the help that you need.
Any other questions?
This is a one-year commitment.
Yes, sir. It can be whatever kind of commitment you want. We have 2-year locked-in rates, and that's what we've required from the carriers that we're utilizing because we think that's important. We want to see consistency, right? We don't want people to jump ship after the first year. But at the same time, you can go back into TRS after 1 year. You have that flexibility for the first time.
When you talk about your annual exams, right, whether the pap smear, mammogram, or PSA, colonoscopy, do you kind of remind employees of that, or, you know, because you said you incentive, you know, give them some form of incentive, you know, if they, because I agree with you, if you know, get yourself checked every year, then you're going to be healthier because you're able to cure whatever ailments may be affecting you. So can you talk to me a little bit more about that?
Yes, ma'am, absolutely. So we have a texting system that we purchased at my company. And so we're able to text out 5,000, 10,000 people at a time. We don't overdo it because it's the last thing that people want is to get a whole bunch of text. But we do friendly reminders throughout the year, usually centered around whatever that month is, right? So Breast Cancer Awareness Month we know is October. So we're going to remind you, we're going to ask you to go grab a girlfriend and go get your mammogram together, or at least book the appointment. We're going to ask those gentlemen to go get your PSA. It's a blood draw when you do your annual physical. Make sure that they draw it or make sure that you get your results. Colonoscopies, that's after 50, you know, and nowadays you can get the box and you can do it at home and you don't even have to do the entire prep and take a day after a day out of work. So we're constantly reminding. We're also on your campus at least 4 times a year. We're going to do that annual enrollment. Then we come back to check on everybody. We come back to prep for the next enrollment, and then we come back to enroll. We are making those reminders, and we also come and do a biometric screening on site. So we're not going to ask you to go to CVS. I'm not going to ask you to go to your doctor and fax in your paperwork. We actually bring a biometric team to every one of your facilities because we want to make it convenient so we get higher participation. And you'll laugh when I say this, but we also make sure everybody knows that it is not a drug test. This is merely a biometric screening. We have a lot of people that choose not to participate. I don't have any idea, you know, that what we use is a finger prick to find out 5 different measurements, and that's it. So we do a lot of on-site reminders. We do info sessions ahead of time. So there's lots of opportunity for interaction. And then we're on call 24/7. People laugh when I say that. You know, when we get the calls at 1 o'clock in the morning or 4 o'clock in the morning, people have lost their ID card. And guess where they're at? They're in the emergency room. That's right. So it's critical. So we get every single call that comes in our office on our cell phones. And unfortunately, every week somebody gets pinpointed by the short stick of the draw. I'm joking. And then they're in charge of phones for that entire week, regardless of what the time is. Obviously, our office is open 7 to 5, but anything after that, we're going to grab those calls so that if somebody needs something and we've got access to it, we're going to be able to get it to them. We can get you an ID card if I'm on a roller coaster. So, and we've done that 1,000 times because that's 90% of the calls that we get after 5 o'clock. Or I've lost my ID card, or I'm at the doctor and forgot to grab my wallet, or my husband's got my card. I mailed my card to my child at college. So we're able to email those to somebody within seconds or take a picture and a text and send them over. We are always available because we know how important it is.
It's awesome.
So employees that come in mid-year, or like, let's say it's a random hire, would you be able to send somebody in to like, yes?
Absolutely. Thank you for asking. Hildoggle ISD was one of our clients. So we committed to coming once a month, and we would either do all of the new hires then, or at least they could come and ask questions. They also call our office. So Greenville just calls our office, and we go up there. Well, I'm up there about every other week, but we go up there quarterly as well. But we would be willing to come here at least once a month to sit down with those new hires. We really like that face-to-face, or we do a Zoom. Some people just prefer a phone call. But yes, ma'am, we are touching every single person. We take that on. We have Employee Navigator is our database that we use. So we would load everybody in there. Then we would come on site and enroll everybody. So we've got all of their information. And then we would consistently do that with all new hires. So we're communicating that back and forth to your HR department and your CFO, terminations and new hires. We want to be an extension of your HR office so that we're not adding any work onto them and we're not burdening them with something that they weren't already doing. And so this would be very similar to TRS from the fact that it's just going to be one bill a month, right? This is not a self-funded where you're trying to keep up with different bills and you've got a different account that's open and you've got to make sure you've got enough money that's seated in it. It would just be your consistent bill a month. Curative has gotten really creative. So they made the statement that, hey, you know what? We know that school districts have to draw that money out of paychecks first before they've got the money accessible. We don't even send a bill until the second month. So there are these carriers really want to change lives, and that's why they've created the different opportunities they have. That's who we've chosen to work with. Please don't get me wrong. I have Blue Cross Blue Shield at Southside. We have United at one of my smaller entities. We just put Cigna in at Extreme. It's a manufacturing of equipment. They will do the halftime show for the Dallas Cowboys on Thanksgiving. We're going to do what's right for that entity. All of the others that we have, we're using a TPA and creating that network and that premium for that particular school district.
And this is just medical and pharmacy, right? Y'all don't have anything to do with the vision and dental? Or...
Sir, we can do it all, but I'm not here to disrupt anything that anybody's already doing.
Yeah.
I am not here to challenge the rates that you all have currently or your provider. We've actually reviewed your rates and you've got really good rates.
Okay.
It's very impressive.
So this would just be medical and pharmacy then?
Yes.
Okay.
And when you talked about the telemarketing with even members of the family that are not necessarily on the plan.
Yes, ma'am.
So if you're taking care of a grandson and they can talk to a doctor over Zoom and get whatever prescriptions they may need.
So they are uploaded into our system. When you sit down with us, we're going to ask you for your dependents. We're already probably going to get a lot of that from Melissa. She would send us obviously your census, but you'd be surprised, right? I've just inherited two nieces that are living with me now, a grandchild, whatever the case may be. So not only are we going to have you go through those dependents that we uploaded, we're going to add anybody that lives in your home, to include a parent that's with you because of medical reasons. They then have full access when they call attentive 24/7 to that telemed, as well as the mental health. Anybody over 18 has to create their own login for HIPAA purposes. But anybody under 18, the parents would be able to make that phone call with them. Highly utilized. It's probably one of the proudest things that I've done. We integrated Attentive into Greenville 2 months before they went live. So we started in, June. They went live September 1st. My rationale was, let's get people used to using it before it starts hitting our claims, right? Number two, let's get them to stop using the TRS and get them to start shifting over. When we come into our info sessions, the first thing we do is ask everybody to hold up their cell phones. We have them put the phone number in right then and there. Free telemedicine is what we put as the header because it never fails. When you need it, you can't find the phone number. So we go ahead and eliminate that immediately. The month of June, we had 30% utilization from Attentive between mental health and telemedicine. That's unheard of. The standard for a year for a company on telemedicine is 10%. For an EAP, it's 3. So we're averaging right now over 30 with all of our clients. We have 44% with Bellevue. So it's something, yet again, we consistently remind people, hey, don't forget that you have it. Don't forget that you have it. So people are really starting to use telemedicine. The statistics right now are 72% of any reason you're sitting in front of a doctor, you could have done over telemedicine.
Well, I appreciate the proactive approach that you seem to have.
and giving our employees in our district the opportunity to customize this. I mean, thank you. I would love to get my fingerprint and a gift card. I mean, it just sounds like you care, and if you care, you're making them care about their health, and then it's just all gonna trickle down.
Right, it's very important. I think coming from a parent with 2 diabetic children, a husband that has epilepsy, everybody up here has heard my story, who fell out of a tree, but I won't even bore you with that. Both my parents have Alzheimer's. This is so real to me. I usually tear up, but I won't today, that I want to make sure every bus driver, every maintenance worker, and every cafeteria staff has access to healthcare. This isn't just for administrators or teachers, right? And so if I can do that, then I've done my job.
Good.
Have a wonderful evening. Thank you so much for the opportunity. Oh, one last little tidbit that is kind of just a little fun leave behind. On Attentive, they are so committed to school districts and education that should you all choose to move forward, they would, at the end of the year, they would give your foundation $33,000, and that would come in a check, and that would be any. It's my parting gift.
Thank you, Ms. Robinson.
Thank you.
If you all don't have any questions, we could move to the next item, Mr. President. The next one is to discuss the 2024 bond project update. I know that we do have just one action item tonight that is connected to our stadium as far as approving a construction proposal request. So I'd like to call to the podium David Iglesias and Chris.
Yes, ma'am.
That will be giving us an update of where we are to include the transportation and the demolition of that.
Good evening, Madam Board President, Board of Trustees, Dr. Trevino. I'm David Iglesias with AK, here to present on the change proposal request number 1, change order number 1 for GMP package 2 for the new Alice Memorial Stadium. This is pertaining to the existing transportation building. With the relocation of the transportation department, that building we have looked at, we provided direction to provide a cost to demolish and to add some additional parking. So that area right there shown in red and in purple was not part of the original stadium scope of work. And so we provided CPR 1 to Weaver and Jacobs to formally include that as a change order to the scope of work. As you can see here, this would be the new site plan. We would connect or add additional parking, approximately 175 slots. So that would complete the landscaping and fencing for the entire site. So we'll have the secured site for the entire stadium. And then that area shown in purple, that is the entry for the visitor side, which is being relocated originally from the east side to the southwest corner. They're providing more of a entry away from the street. And so it'll allow for stacking and, ticketing and so forth there without, having any major issues with traffic on that major road. So with this being said, the overall cost summary, the approved contract amount currently is the $34,973,612. This change order would be an add to the contract amount of $1,868,789. We have been negotiating this cost with Weaver and Jacobs for the last couple of weeks. We are anticipating still some additional savings that we're working on. As of earlier today, we received some additional information. We can possibly deduct it another 100,000. So we're trying to get the best value for Alice ISD. So we're working on that. And so the new contract amount would not exceed the $36,842,401. Also included in your packet was a draft of the change order 1. It is the AIA document G701. You all have that? Did you see that? So on there is the official change order document. This is just a draft that we drafted indicating the change in the contract amount. You can see the original contract sum listed there, the 34 million, and the net change by previous authorized change orders, which is 0 because none have been approved thus far. And then contract sum prior to this change order, which is the same amount since there hasn't been any previous changes. And the new contract sum would be increased by the 1.8 million, which we're still negotiating that cost, so we'll have a final number before we issue this document for signature. So this would be an approval on the amount to not to exceed the 1.8 million. On here, we do have an indication of an increase in time of 66 days to the contract amount. In further discussion with Weaver and Jacobs, the 66 days is not directly correlated to this additional scope of work. So they believe that the scope of work can be done within the timeline of all the other site work. So we're recommending not including the 66 days. So that'll be eliminated from the change order, the final document. However, the 66 days, there is a correlation possibly to the block arriving on site, which we're tracking. We have been notified by the manufacturer that there could be possible a delay. And so we've been tracking that information, and we're getting updates weekly. And so we don't know the full extent, actual delivery date at this time. But as we receive additional information, we'll come to the board to present. But currently, we're not extending any contract time to the original contract.
And just for the record, as far as interest that we have accumulated with the bonds, it's 1.7 million. We shared that on Monday, but just for everyone that's listening, the cost to demolish or the change order right now is saying not to exceed 1.8, but we are still trying to lower that.
Correct.
And working with both parties to make sure that that happens, but the interest is at 1.7 right now.
I do want to add, we still have a contingency allowance within the contract of the project, so we do not want to utilize any of that towards this. This would be an actual change order to the contract. Since, there's still quite a bit of construction to go, we want to maintain as much of the contingency as we can to the very end, hopefully bringing some money back to the district.
So then tonight, the recommendation is just to approve the construction proposal request related to the stadium project to include not to exceed the 1,68,789. Do y'all have any questions?
What was that? You said there was the block. What was exactly was it?
So during the selection process of the block, we went through 3 different manufacturers to try to get the color based on the renderings that we were trying, the design intent of the project. And so based on available colors from these manufacturers, get multiple samples, review. I don't know if you've seen the little mock walls that they built out there by the job
You're
trailer.
literally talking about blocks.
Yes,
Okay, I was like,
block,
okay,
yes,
all right,
block.
I'm sorry.
And so now that we have an approved color, multiple colors actually, we got information back from the block manufacturer of possible delay of delivery, right? So that's what we're tracking. At one point it was February, now we're into January, so we're hoping tomorrow they come out with a new, the manufacturer comes out with a new production schedule. And so we're hoping to get some good news tomorrow as far as, getting pushed up in the line. So we'll continue to track that. Once we have a more definitive time, then we'll be back.
But that won't bottleneck the construction phase of it, or you
There-
continue?
So knowing that in advance, instead of just having essentially those slabs or those foundations that have been poured for a month and a half, instead of just having those sit there, if you drive by, you'll actually see all the plumbing being fabricated and built,
Right.
all the risers. Typically that happens as the masonry goes up, as the block goes up. So instead of just sitting there and killing time, we're being proactive and trying to actually do things that we can do. So that way there's a limitation on any delay whatsoever. So thinking outside the box on that, not the normal sequence of construction, but don't let it sit there. Let's get something done. So that's the mentality that we have right now as we wait, essentially.
Based on the OAC meeting we had earlier today, which we meet bi-weekly, you can see, they are trying to beat the schedule with tasks as they can, the sequences and so forth. So based on the amount of work that has been done thus far, we can maintain that.
And you had people come from Houston as
Correct,
well?
and we had people, we had the director of our construction department come down and doing a site observation yesterday. And he was pretty impressed with the amount of work that had been completed based on the schedule we currently have. The manpower and the knowledge Neto had, overall knowledge of the project and the subcontractors and so forth. So that was great news that we got from him as an outsider that hadn't really been too involved in the project to come in and see that firsthand. So we're planning to have him come once a month to continue to do that. Jerry and I will be alternating trips weekly just to be out here. We did suggest, they do have their daily log as far as manpower, sharing that just so we can track the amount of, people out on site, workers daily, just so we can keep track of that. So we'll continue to work with Weaver and Jacobs to be sure that, we have the manpower available out there to keep progressing.
And they will be there tomorrow at 4 o'clock to continue to work hard. And I know that Nick and Tim have been out there making sure that everything gets done.
The last concrete foundation we poured the Wednesday before Thanksgiving at 8 a.m. So they're working, trying to get everything done as much as possible.
So when can we do a site visit? I'm sorry.
As long as we have the PPE available, yes, that can be arranged. I don't know if that needs to
We
be-
were thinking of a topping out ceremony where we would have the board, some community members, students go in and sign the final beam. Before they finish that off, but I mean, if you all want to schedule something, we can definitely do that. I mean, if
But
it's
yeah,
gonna be more than
a site
4
visit
hours,
with any one of y'all, that way we can understand and know what's up ahead, whatever. I wanna get a visual of, say, I know I've been at y'all, is it gonna be done in May, every meeting? And I just wanna make sure that if it's later on, you need to let us know.
Yeah.
I'm not trying to, well, yes, I am. I'm trying to rush y'all, but in a safe way, because it's for our kids. Graduation's coming up, and I don't want to have it in Kingsville again. But is it possible? And that's my deal. It was hard for us, for me, it was hard for me to go to San Diego for home games and seeing that, it's not the same. And people already seeing the product and they wanna start as soon as they can. But here we go again, in a safe way, make sure the building's correct. And I'm sure we have the right crew there. Now, hopefully it'll be in May. I think you were here at the meeting last. If it is in May, good. But we just need it to be as nice and it looks like it's gonna be beautiful. And that's what I want.
Please give Lee a private tour and
Yeah.
get her over with.
I have no doubt it'll be beautiful, but we definitely want it, and we know some things are out of your hands, especially, the material not arriving when it should, so we do understand.
Yeah,
I do have a few questions, because I wasn't here when the original contracts were made. So I just want to get a clear understanding. So originally, this parking lot wasn't in the original contract because we were thinking that we were gonna continue to leave the bus barn there? Is that what I'm understanding? Okay,
We didn't have another site.
we didn't
I
have
mean, it
enough,
was gonna cost an enormous amount to
right,
just uplift it to another
right, right.
facility, like 10 million, and I
Right.
think
This is a
that,
bargain.
Yes.
Jennifer almost passed out on that one.
Yes.
I think everybody had
No,
a-
I think, and the new area that we have, so now that we have that, we can create this And even though, well, it's 1.8 right now, but we're trying to lower it, correct?
Correct. We're
Okay.
working to do everything we can to save additional monies. And
Right.
yes, it was always shown as future parking lot,
Right.
whenever that would be. Luckily, we're in a position
Right,
that future will be with the actual stadiums.
awesome. And then the money that, well, whatever it may be, we know it's not gonna exceed 1.8, but we've already made 1.7 with the money that we have that's being invested. Okay. I just wanted to make sure.
And I know that we met with the team earlier today and they had said they already could bring it down 100 Gs and that Jerry was working at bringing in another 100 Gs, so. Just saying, you know,
He's gonna pick up a shovel and a hammer himself.
whatever it takes.
Yeah.
A couple of comments. I really like the idea of bringing in the visitors inside the parking lot area and keep them away from the street.
Thought it was important, especially when the line starts stacking, you're off the street.
You're off the street.
Did you mention how you were going to change the entrance too?
Yes, as far as the location, but yes, the entry, and we can show an updated rendering of what that would look like.
It was, remember, gonna be on Stadium Drive, but now it's on Sage. Yeah.
Same drive?
Well, on that side where the visitors are gonna come in, that grand entrance will be there.
And then there's a potential for $33,000 from another vendor. What will be your potential contribution?
She was awfully generous. I was hoping y'all were gonna ask that.
Don't turn red, don't turn red.
We've always been there to support.
I had to ask that.
I'm glad you asked, because I was gonna ask.
Have the authority to.
Since everybody's in a giving mood,
That's giving.
Yes.
Well, it seems real good. I passed by there just earlier. And chinga, everybody's working.
I'm impressed with your welders.
Yeah, they're working late, they're
They're
working.
working late. I passed by there one day and they're like, man.
And that was one of the comments that our construction director from our Houston office mentioned about the erector being out of Houston, correct? And is one of the best erectors that he's ever worked with, so that was positive information.
Only the best for Alice, ISD.
There you go.
Well, I mean, when the general public says, man, those guys were out there late, it's like, wow, yeah. They notice.
Right.
So that's
And
good.
you're out there early too.
Yeah. Great. Good job, Doug.
Thank you.
Yep.
Those are the only two recommendations. Thank you, David, and thank you.
So we have to make a.
On to item number 6 of the agenda. The action item 6A, discuss and consider approval of construction proposal request CPR number 1 related to the stadium project.
And then just for the record, that we are approving the $1,868,789 for the transportation complex, not adding days at this time.
Thank you, Dr. Trevino. At this time, do we have a motion?
So moved.
We have a motion by Mr. Ramon. Is there a second?
I'll second. I'll second.
A second by Mr. Reeves. Is there any discussion at this time? No? Mr. Benya?
Aye.
Mrs. Guerra? Aye. Mr. Reeves?
Aye.
Mr. Ramon?
Aye.
Myself, aye. Motion passes. Thank you. And on to item number 7, to adjourn. Before we adjourn, I just want to wish everyone a happy Thanksgiving to all of the employees of our district, to the principals, Dr. Trevino, staff, everyone. We're very thankful for all the work you've done on behalf of the district. So we hope you have a relaxing and joyful Thanksgiving break. Happy Thanksgiving, and to every one of my fellow board members, it's been a privilege. Very thankful to serve along you. Happy Thanksgiving. The time is now 6:09 and this meeting is adjourned.
Later or? Yeah, let them know that it's.